Well, hello. Welcome to Instagram live interview. My name is Erin Sinavi. I am a member of the JIVINITI Coalition and co-lead investigator for Project Gaia. I am super excited today about our guest. So today we're going to talk to Dr. Shikha Singal Murchia. She is double board certified in internal medicine and lifestyle medicine, and she is a member of the Physicians Committee for Responsible Medicine. So let me find her. You can find her at doc_in the kitchen, and she's awesome. So let me get you. So there you are. Hold on. Sorry. There we go. It like disappeared when I. Hopefully you can help. Hi.
Hi, how are you?
Oh, I'm great. It is so amazing to meet you. I've heard awesome things about you and from our mutual friend Nivi Jaswal.
Yes.
So I am just thrilled that you agreed to do this interview.
Yeah, thank you for having me. I've seen a couple of the interviews you've done. They're awesome.
Oh, good. Yeah, they're actually a lot of fun. I was very
Yeah.
intimidated at first, but they're just kind of fun because they're lives and anything can happen. So anyway,
That's good.
but I think, let's just start off today by talking a little bit about you and tell us a little bit about your journey into going plant-based.
Yeah, so my journey, actually, I was born in a culturally vegetarian family. My mom and dad are just vegetarian, so I was always vegetarian to begin with. Never ate any animal products except dairy, of course. I grew up in India. It's a big part of Indian cultures to eat dairy and a lot of milk products, desserts made out of milk, and but so my mom actually always, which is an unusual thing, when she always had fresh food in the house. She's a great cook. And I never wanted to cook, never learned how to cook, never wanted to. And but she was such an amazing cook. She always made healthy meals, and she always had the salad with our meals. So we kind of grew up that way. But then when I grew up and went to college, I started eating eggs. Everybody says, "Oh my God, how are you getting your protein? And you're gonna die." And then our dining halls only had eggs for breakfast every day, and I was like, yeah, what else do I eat? So
Mm-hmm.
then I started eating eggs, and even my dad was very staunch vegetarian. He's like, yeah, I guess I don't want you to die, so go ahead and eat all the eggs.
Of course not. We
Yeah.
must eat those eggs.
So then I got married, I came to the United States, and then here I got introduced to the vegetarian American diet, pretzels and pizza and Coke, um, and I was in residency, always tired, so I always just grab junk food. The cafeterias in the hospital always had like mac and cheese and things like that.
Yeah.
So I 4 years ago, I attended the conference at Harvard through the Institute of Lifestyle Medicine, where I actually met Dr. Dean Ornish, which is amazing.
Oh, he is awesome.
And I was blown away. It's like, oh my God, what is all this? But then you just kind of park in the back of your head. You're very busy. You're like,
Mm-hmm.
yeah, this is all great. Okay, fine. And
Right.
then but it just kind of stayed in the back of my head. So I re-registered for the conference in 2020. This is before COVID started.
Okay.
And then the conference became virtual, and I really paid attention to it. I took 3 days off. I sat at home. I wrote notes.
Mm-hmm.
And then all the speakers that were speaking, I looked them up, and I looked up and then I said, this is amazing. What is all this? I'm going to go plant-based for 1 month, and I'm going to try it. So
Okay.
last June, and I quit eggs, I quit dairy, I started to cook with less oil, and then my husband goes, what are you doing? So, and he's always been on that kind of keto kick for the last 10 years,
Oh,
butter
yeah.
is
A lot of people
great.
are, right?
Yeah, put like fat in everything, put
Yeah.
nuts in everything. So then he says, you know what, I said, I'm going to study for the lifestyle boards. And then he goes, sure, you know what, I'm going to do it with you, because he's a physician as well.
Yeah.
And then so he started studying with me, and when we just kept looking at the data and the board review books, and then I did the Cornell plant nutrition
Yeah.
course,
Yeah.
and we're like, that's it, we're
Yeah.
never. Yeah.
Oh
So
my.
I didn't think of myself as unhealthy, but I dropped over 15 pounds. He dropped weight. It's more energetic. I don't wake up stiff anymore.
Yeah.
Which I just said, I used to always like, I'm getting old. I just have to wake up stiff. It's fine.
Right, right. I mean,
Yeah,
that's a lot of us, I think, grew up thinking. And also,
yeah,
interestingly enough, how you mentioned, you're already a physician and you didn't
yeah.
hear this stuff in school.
No,
Same, right? And we all kind of have to self-educate, and that angers me a little bit, to be quite
yeah.
honest. Why, why was I not taught this in school?
Exactly? And I tell my patients that, and they're like, "So why didn't anybody tell this to me before? Like, what?
Yeah,
What are you talking about?" And I'm
exactly.
like, because I didn't know about this before either. So I
Yeah,
can't imagine my colleagues knew about all this.
right.
Yeah.
So speaking of that, so tell me a little bit about your work and how this taking all this knowledge, how that translates into the work you do.
Yeah, so I'm a primary care physician. I've worked at my current practice for 11 years. And I was always interested in health and, obesity and its related conditions. So I've been counseling patients. I even prescribe medications like appetite suppressants for weight loss. Um, uh, and patients do well, but some they didn't. So I've started incorporating it in my practice, just regular.
Mhm.
Anybody who has diabetes, I utilize all the resources through the American College of Lifestyle Medicine. They have amazing flyers that we can print and access. I use flyers from the Physicians Committee of Responsible Medicine. I ordered a whole kit from them,
Love that.
and I share that with
Yeah.
my patients. And and it takes a lot of counseling. Like sometimes you give these flyers, you talk about it, and patients come back and they haven't fully registered it, which is fine because I didn't register it initially, right?
Right. Right.
um, so then I just keep counseling them. So I incorporate my visits. It's hard. It's
Yeah.
really hard because there's not enough time.
Right.
But anybody who comes in for diabetes, anybody who comes in for obesity management, so now my colleagues have actually started referring me patients for weight management. That's
Fantastic.
how I get that's how I get patients into my door, and then I counsel them on diet and
Yeah.
on
Yeah.
on plant-based nutrition. Yeah.
Sure. Isn't that interesting? So everybody wants to lose weight. And that's the other thing I find
Yeah.
too in my practice is patients are like, I just want to lose weight. And
Yeah.
I try not to make it so much about the weight, but if that's what motivates them,
Exactly.
great. I'm always like, well, and that's going to be a nice side effect. That's what I tell my
Yeah.
patients. I go, the great thing is hopefully you're going to prevent or reverse maybe your high blood pressure, your
Yeah.
diabetes, all of those things, the autoimmune.
Absolutely.
So I love that. It sounds like you're doing amazing things. One of the things that, of course, that is happening and doesn't seem to be going away is COVID-19. Uh,
Yes.
so I just wanted to talk a little bit about that because, we know that certain groups, are underserved groups in particular are disproportionately affected by COVID-19 for a
Yeah.
lot of reasons. And it seems like a lot of them have those chronic lifestyle diseases, which translates, unfortunately, into poorer outcomes. And so why do you think we are seeing some of these differences in different populations?
Yeah. I mean, I think, as COVID-19 has highlighted that there's disparities in our healthcare system, you know, and as a physician, and as I see my colleagues, we're not inherently like, treating certain ethnic minorities differently, but I think there may be, biases that are built in and we don't realize it. But I think some of the uh, things that maybe like their socioeconomic status, African American and Hispanic minorities, even the Native Americans have been disproportionately affected.
For sure.
They're more likely to get COVID, especially I think the Hispanic minorities are much more likely to get COVID than if you see the Caucasian and the Asian
Right.
minorities. And and a lot of it is access to healthcare. And
Right.
it's not that access is like lacking, but they may be in like more frontline work, like infrastructure work, hourly wage jobs, which you don't get sick time.
Yep.
Uh, you're living in crowded conditions in multi-generational
Yeah.
homes.
Yeah.
Um, and so, you may be taking public transport. You can't work remote. Like, a lot of us were able to switch to remote work,
Mm-hmm.
but they may not be able to do
That's
that.
right.
So they're exposed. So, makes them more vulnerable. The other thing is, I think, again, ties back to nutrition. They have a lot of more underlying conditions.
Right.
Obesity rates are higher. They have
Mhm.
more, and then related type 2 diabetes, hypertension, all that is higher in these ethnic
Yeah.
minorities, and hence they're more affected, and then they have poorer outcomes. There's higher ICU admissions, higher death rates, things like
Right.
that.
And I think you're absolutely right on all of that, right? And I know
Yeah.
that obesity is the number one risk factor for poor outcomes with COVID-19. And
Yeah.
you mentioned a lot of the social determinants of health that cause, that are the root causes of why, unfortunately, some marginalized communities are more affected.
Yeah.
We are now seeing some more COVID and nutrition literature emerge that shows that eating maybe a more plant predominant diet seems to have better outcomes. There's
Oh,
unfortunately,
yeah.
as a researcher and as a physician, you have to have a preponderance of evidence. So,
Yeah.
I know we're working on Project Gaia and
Yes.
trying to get some answers to those outstanding questions. But why is this research important in your opinion, and why is nutrition not being discussed more at the policy level or even in the media with regards to COVID?
Yeah, I think it baffles me. I mean, there was, I think, a study that was published in June of this year in the British
Yeah,
Medical Journal that it was
yeah,
a big study, and I think I've seen it on some of the plant-based physicians' Instagrams, etc. And I've read about it too. That people, I think, who ate plant-based, they'd interviewed more all healthcare workers, mostly physicians and nurses in six
right.
countries. And I think if you ate a more plant-based diet, you were 79% less likely to get severe COVID. If you had a pescatarian diet, you were 58 or something percent less likely to get severe COVID. And I think if you were eating a carnivorous diet, you were more likely to get severe COVID.
That's
So
right.
that's great. I said, this is, so that's, at least there's something to go with. There's something to begin with. And Project Gaia is great. And thank you for, choosing me as your partner. If we can get more data on this, then maybe we can affect public policy. Maybe we can, tell our government officials that, hey, look, we should be talking about nutrition. And I think it's not discussed because of probably powerful lobbies. I mean, I'm not 100%
Yeah,
sure, but the
yeah,
meat and dairy industry,
yeah.
that
It's
it's
hard.
not, yeah. And
It's hard to get the
I think
message
even
out
in the
there.
media, it's probably taken down because there's no powerful sponsors in the media that,
That's
discuss plant-based nutrition and things like that. And then that's why what your project is doing is really, really good. And
yeah.
I'm excited to see the results when you guys
Oh my
have
God.
it.
You've been such a great partner, and we really want to thank you for sharing the posts and sharing the
Of course.
survey and everything. And I know that people can find it in the link in your bio, in
Yes, in my bio.
Bright Plant Life's bio. But Nibby and myself are so grateful to you and all the people that are partnering with us just to get the survey out. Because you
Yeah.
mentioned that recent study, which is amazing,
Yeah.
amazing. One of the limitations, unfortunately, is the sample size, and as well as
Yeah.
kind of the diversity of the sample, which is
Absolutely.
things we
Yes.
really want to make sure we touch on. So I just have one more question.
Yeah.
If you had one piece of advice that you would recommend people can do today to improve their health, what would that be?
Diet. Change your diet. I mean, I think just getting in a lot more fruits and vegetables. So I've seen in my primary care practice, everybody's not accepting of, like they're like, oh my God, I can't go vegan, tomorrow.
Yeah,
So I'm like, okay, try it for 2 or 3 days a week. Just eat vegetables and beans and whole grains for a couple days a week and see how you do.
yeah,
Uh, see what you feel like. So that's my big advice is just, diet, diet, diet. It's a root
yeah,
cause of so many things,
yeah,
and it can affect, even our immune system. There's so much research coming out on the gut microbiome, and that's all related to the diet. So if you want to build a strong immune system, hey, eat healthy food, eat fruits, vegetables, whole grains, and beans.
yep,
Uh,
100%. And I know I don't know if are you attending the ACLM conference this week? Have you?
I am not.
Oh,
I was registered for it because I was gonna go to Texas.
oh, yeah, yeah,
And
me
then
too.
when it became virtual, I omitted it. I was like, I'm gonna go live. I'm gonna go next year when it's
Me
in
too.
person.
Okay. Well, sweet. Well, I'll definitely see you then because
Yes.
yeah, it's really good. But yeah, they did. There was some studies they talked about with the gut microbiome. There was a whole lecture on it, and I think yeah,
Oh,
the more research we're seeing on the gut health is showing that the more diversity of plants you can get, the more diversity of good microbes you're going to
yeah.
have, and the healthier you're going to be. So I just want to thank you again so much for joining us today.
Of course.
Where can people find you if
So
where
I actually just
practice too?
practice.
Yes,
Yeah, I know. I only practice in Massachusetts, in East Bridgewater. My practice name is Compass Medical. Of course, I post recipes on my Instagram, Doc in the Kitchen. I'm a member of the PCRM, and I hope to next year become a Food for Life instructor with the PCRM. So then I'll probably be doing some more cooking videos, etc.
oh,
Uh,
fantastic. That's wonderful.
yeah. So
And
that's it for now. I don't know what's going to be in the future, but
yeah,
yeah. So
well,
that's what.
thank you for all the amazing work you're
Of
doing.
course.
I mean, it's so valuable, and I know you're changing lives. And again, thank you for partnering with us on
Of
Project Gaia.
course. Thank you for having me.
All right. Well, you take care.
Bye.
Bye bye.